Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about a question many families quietly worry about. Why do bones break so easily in older age?
This is a very important topic. A small fall, a step off a curb, or even a twist in the bathroom can lead to a serious fracture in older adults. But this does not happen for no reason. There are clear causes, and there are real ways to lower the risk. Let's walk through it together in simple, calm language.
So, doctor, in easy words, why do bones break more easily when we get older?
As we age, bones slowly lose their strength. Inside the bone, the dense structure becomes thinner and more hollow. If the bone loss is mild, we call it osteopenia. If it is more severe, we call it osteoporosis. Osteoporosis means the bones are fragile enough that even a small fall, or sometimes normal daily movement, can cause a fracture. At the same time, many older adults have weaker muscles, slower balance, poor vision, or medicines that cause dizziness. So you get two things together: weaker bones and a higher chance of falling. That is why fractures are more common in older age.
Is this just a few people, or is it a big problem?
It is a big problem. From around age 50 and up, many people have some degree of low bone mass, and the numbers rise with age. Women after menopause are at higher risk, but older men are also affected. Most hip fractures happen in people over 65, and hip fractures are one of the most serious injuries in older adults. So this is not rare. It is a major issue we should talk about openly.
What are the main reasons bones become weak and break more easily in older adults?
Some reasons we cannot change. Getting older. Being female after menopause when estrogen drops. Family history of osteoporosis or hip fractures. Small, thin body build. Some reasons we can change or manage. Not enough calcium or vitamin D over many years. Little physical activity, especially no weight-bearing or strength exercise. Smoking. Heavy alcohol use. Very low body weight or repeated crash diets. Long-term use of certain medicines, such as steroids or some cancer and rheumatology drugs. Medical conditions like rheumatoid arthritis, thyroid problems, kidney disease, or gut diseases that reduce absorption. And then there are things that increase falls. Poor vision or hearing, unsafe home environment, weak leg muscles, low blood pressure, nerve problems, or medicines that cause sleepiness or dizziness. Most older adults who break a bone have a mix of weak bones and higher fall risk.
If an older person breaks a bone from a small fall, or if the family is worried, how do doctors check what is really going on?
We ask two key questions. Was this a fragility fracture? That means a fracture from a simple fall or minor hit. If yes, we treat it as a warning sign for weak bones. And what is this person's bone strength and future fracture risk? To check bone strength, we often do a bone density scan, called a DEXA scan. It is non-invasive, quick, and painless. You lie on a table while a scanner measures bone density at the hip and spine. The result is given as a T-score, which tells us if bone density is normal, mildly low, or clearly low, like osteoporosis. We also look at your history: past fractures, medicines, smoking, alcohol, family history, other illnesses. Sometimes we use a simple risk calculator to estimate your 10-year fracture risk and help decide if treatment is needed. We may also do blood tests to check for low vitamin D, thyroid problems, kidney issues, or other causes.
Once you find that bones are weak, how do you protect them? Can you start with simple steps, then explain the stronger treatments?
Yes, we always start with foundation steps. These are non-invasive and very important. We aim for enough calcium from food and add supplements only if needed based on your doctor's advice. We check vitamin D and correct low levels when needed. We encourage regular weight-bearing and strength exercises, like walking, gentle stair climbing, simple leg and arm strengthening, or balance exercises. We stop smoking and keep alcohol low. We improve balance and safety, review medicines that cause dizziness, check vision and hearing, and make the home safer. For people with mild bone loss and low risk, these steps plus follow-up may be enough. For those with osteoporosis or higher fracture risk, we add medical treatment. There are medicines that slow bone loss or help build stronger bone. Some are tablets, some are injections given every few months or once a year. These medicines, used correctly under medical guidance, can lower the risk of spine and hip fractures. Your doctor will choose based on your age, sex, kidney function, fracture history, and other health conditions. If a fracture has already happened, especially hip or certain spine fractures, surgery or special procedures may be needed to fix the bone, reduce pain, and help you walk again. These are more invasive steps and are decided by orthopedic and spine teams.
What can happen if weak bones and easy fractures are not taken seriously?
The complications can be serious. Hip fractures can lead to long hospital stays, bed rest, blood clots, infections, and loss of independence. Some older adults never return to their previous level of activity. Spine fractures can cause long-term pain, loss of height, and a bent posture that can affect breathing and daily function. Wrist and other fractures may seem smaller, but they often signal weak bones and risk for bigger fractures later. Many people become afraid to move, which leads to more weakness, more falls, and more problems. So one fracture from a small fall should never be seen as just bad luck. It is a sign to act.
How can older adults and families lower the risk of fractures in real life?
Think of 3 parts working together. Protect the bones, eat enough protein and calcium in daily meals, check and treat low vitamin D if present. Stay active with safe, regular movement and some strength or balance exercises. Prevent falls. Make the home safe with good lighting, no loose rugs, clear walkways, handrails on stairs, and grab bars in the bathroom. Wear stable shoes. Check eyes and ears regularly. Review medicines with your doctor to reduce those that cause drowsiness or dizziness, if possible. Use a cane or walker if advised, without shame. Use screening and treatment. If you are older, especially over 65 or postmenopausal, ask your doctor if you need a bone density scan or fracture risk check. If you or your parent has had a fracture from a small fall, ask directly. Do we need to check for osteoporosis? Do we need medicine to prevent another fracture?
Can you give simple do and don't points for our viewers?
Do take any fracture from a small fall in older age seriously and ask for a bone check. Do talk with your doctor about bone density testing and fracture risk if you are in the risk age group or have risk factors. Do follow medical advice on exercise, nutrition, vitamin D or calcium if needed, and prescribed bone medicines. Do stay active. Even gentle daily walking and balance exercises help. Do not ignore back pain, height loss, or curved spine as just aging. It may be treatable fractures. Do not stop prescribed bone medicines suddenly because of something you heard online. Always discuss first. Do not rely only on random supplements or miracle cures that promise instant bone repair. Do not smoke and avoid heavy alcohol if you want to protect your bones and balance.
For someone watching whose parent or grandparent keeps falling or just had a fracture, what is your message?
Please do not say, "They're old, nothing to do." A fall or fragility fracture is a warning and also an opportunity. Support them to see a doctor, check their bones, review medicines, and make home changes. With the right steps, we can reduce the chance of another fracture and help them stay independent longer.
Thank you, doctor. And to everyone watching, this video is for education only. It follows the spirit of major medical guidelines, but it is not personal medical advice and not a reason to start or stop treatment on your own. If you or a loved one has had a fracture from a small fall, or you are worried about weak bones, please speak with your own doctor or local clinic for a proper plan. Your health is your wealth. Stay tuned for the next doctor tip you can trust.